Well, let's say good morning to Dr. Dareen Siri. She's one busy lady at Midwest Allergy. Let's get right to it. There appears to be some concern, some question about people who have allergies. Maybe they should or should not take the vaccination intended to take care of COVID. Bring me up to date.
Good morning. Yes, we're getting a lot of questions about that, so I thought this was a great opportunity to address those. So thanks for asking about that. As you know, there's not a specific COVID vaccine that's yet approved, and the FDA is certainly monitoring the situation very closely. But as you know, we've heard of the vaccine, specifically the Pfizer vaccine called BioNTech, that has been used now in the United Kingdom, and of the several hundred of vaccinations that have been provided to healthcare workers as the frontline workers, there were a couple of cases of anaphylaxis. And so anaphylaxis is that allergic reaction where you can have, hives, swelling, asthma attacks, and some severe allergic reaction that is systemic, goes all over the body, and certainly can cause concerns and even potentially fatalities. So good to hear that those two individuals who have had anaphylaxis, who are healthcare workers, are recovering. They're doing well. They were under the care, as we know, of allergist immunologists for some type of allergic condition, and were both patients who have carried EpiPens. So that's all that we really know, and certainly right now the British allergy authorities have worked with the British councils to look into that, and they currently are warning patients who carry an EpiPen and have history of severe allergic reactions to maybe hold off on getting the vaccination until they look further into it. As we know, this is all preliminary, and so the vaccine has not hit the United States yet. The Illinois Department of Public Health and the CDC have put out some great information out there, FDA, Pfizer, and it's all publicly available that people can review and look into. Right now, the thought is that, what is the cause of this? We know that the components of the vaccine, there's really not a lot in there. There are no preservatives. There's no food protein. There's no, peanut, egg, milk, any of those things. However, the virus is encapsulated in something that is lipid, and something that makes the lipid and the virus be uniform and water-soluble, and something called PEG, or polyethylene glycol. Now, polyethylene glycol is widely used. We use it a lot. It's in medications. It's in industry. It's considered non-toxic, and it's safe. But yes, there's individualized persons. People with our wide variety of people can have such varied immune systems and things like that. There's always somebody who might have a situation where they're allergic to stuff. So it has been reported cases of anaphylaxis to PEG, to polyethylene glycol. And it's very similar to polysorbate. So polysorbate and PEG are used in vaccines too, and in medications. And so there have been rare reports, and again, they're exceedingly rare, just like vaccine reactions are exceedingly rare, of people who have had anaphylaxis to these components. We have several patients in our practice, including healthcare workers, that are allergic, for example, to polysorbate. We test them in our clinic, and then we advise them on how to get vaccines and how to get medications and which medications to use all the time. So PEG is known to cause some allergic reactions in rare cases. You might be familiar with some of these. If you've ever had a colonoscopy, it's the same type of ingredient that's used in some of those preps, like Go Lightly, with Relax. Maybe you've taken that before, as a laxative. Yes. And so I think that the best advice is we're going to follow this along. The first people who are going to be getting these are healthcare workers and people at high risk, such as in nursing homes. Most of the population is not going to be on the very, very first edge or cusp of people getting the vaccinations. They're going to learn more information, figure out, which patients are going to be at most risk. And certainly, I think we just need to be patient and look ahead, that there's a light ahead, and certainly talk to your allergist immunologist, your specialist, your physicians about a personalized individual treatment plan once we figure out what the issues are with the vaccination. Yeah.
Dr. Siri, how can they get a hold of you?
Yes, we are at 217-717-4404. Our asthma website is www.asthma2.com. We have a lot of exciting new treatments. It's a great time to be an allergist immunologist. We've got new drugs that have now been approved, all of which we have been studying in our research center. Drugs for hereditary angioedema and other rare diseases we treat. Severe eczema that's coming up, a pill to treat severe eczema. How fantastic. Works even better than some of the things that are currently available. We've got a lot of studies on eosinophilic esophagitis, on asthma, you name it. And so certainly if people are interested in getting treatment, tested, or just participating in some of our trials, they should come check us out.
Thank you, Dr. Siri. Have a good week.
You too. Thank you so much.
She is with Midwest Allergy, Dr. Dareen Siri, one of our frequent, every other week she joins with us on AM Springfield.